Hi, I'm Joe Watso. I'm the director of the Cardiovascular and Applied Physiology Laboratory. I'm going to show you some of the things that we do in the lab to test cardiovascular function. In the lab, we use cardiopulmonary exercise testing using a face mask where we collect the air that you exhale during exercise, and from that, we can measure the amount of air that you move and the concentration of oxygen and carbon dioxide. We measure blood vessel function using a test called flow-mediated dilation. And to do this, we place a cuff around the lower arm and use ultrasound to measure the blood flow before and after that cuff is occluded. And what this tells us is an index of how the heart actually functions, because blood vessels in the arm are actually correlated with how the blood vessels in the heart dilate during different stimuli. We have a non-invasive system to measure blood pressure for every single heartbeat during our trials. To do this, we place a cuff around the finger, and it's calibrated to provide us an index of blood flow and calculate pressure. And we can measure blood pressure changes that occur at rest normally, and also blood pressure responses to different stimuli like exercise. And this is very important because it reflects how the nervous system controls blood pressure and how reactive blood pressure is to different tests. Another device in the lab allows us to measure blood flow in the brain. To do this, we place a Doppler ultrasound near the temple, and using sound waves non-invasively, we can assess how blood flow changes at rest, just with normal breathing, and also in response to different stressors. We also have devices that allow us to measure blood pressure in daily living. We give these devices to participants and they wear them for 24 hours in a row, and they make measurements every 30 minutes throughout the day. And this is actually a stronger indicator for how healthy your heart and blood vessels are than just measuring blood pressure at a single point in time. So we can measure arterial stiffness non-invasively using a tonometer, which is just a pressure wand that we place in the carotid artery, and using a cuff that goes around your femoral artery and your upper leg. And from that, we can measure the velocity of the pulse wave from the heart, and that gives us an index of arterial stiffness. We measure lung function using spirometry, which is a test where you breathe in and out through a mouthpiece, and it measures the rate of airflow and the absolute air volume that you breathe in and out. And that's important because it can predict whether you have any potential pulmonary issues or limitations to your breathing.
All the way out, keep pushing, good job. And
as you can see, we have a wide array of tools that we use to try to understand how to keep the body healthy as we age. If you want to learn more, you can visit caplaboratory.com, CAP Laboratory, to learn more about us, what we do, and all the people that make this possible.